All right. I'm here with my patient Molly today, and she's just spraying the lateral side of her ankle in a gopher hole. So we're going to be doing some non-thermal ultrasound to help with pain relief and tissue rejuvenation. She does have a few contraindications. She has a pacemaker, and then I would need to check sensation around the ankle because she does have diabetes, and also just because it's good to check that anyway. So for video today, Molly does not have a pacemaker, so we don't need to worry about that. So again, indications for doing ultrasound with her are she has an acute ankle sprain, and we want to help with the pain and tissue regeneration. Contraindications would have been the pacemaker that we deemed she doesn't have, and if she was lacking sensation in the skin in the area that we're going to ultrasound. So Molly, what I'd like to do is put some, I'll have you lay down in just a minute and put some gel on your ankle, and I'm going to move the head of this wand around in just small circles around the ankle area. You'll feel kind of the coldness of the gel and the wand moving, but other than that, you shouldn't really feel anything. But there is work getting done on the tissues below. Is that all right with you? Mm-hmm. All right. So I'll have you go ahead and lay down on your back so you're comfortable. And are you all right if I touch your foot and ankle? Mm-hmm. All right. Turn you just a little. All right, so for parameters on the machine, we are doing ultrasound, so I'm going to pick the sound button. 5 minutes is just fine. Since we're going to a more surface level tissue, we're gonna go with 3 megahertz, and we want a 20% duty cycle. And then for the intensity, I want to go between 0.5 and 1, so we'll just go right at 0.5, and we'll get started. All right, and the skin around the ankle and talus looks all intact, and can you feel my touching you there?
Yeah.
All right. So I'm gonna go ahead and put some gel on here. It might be a little bit cold.
Okay, that's okay.
All right, so then now that I've got the head in place on the patient with the gel and all our surfaces are in contact, it's safe to go ahead and turn on the machine and get started. So Molly, we're gonna go ahead and start.
Okay.
So as I'm doing this, I'm just gonna be moving the head around in small circles, not exceeding 2 to 3 sizes, a size exceeding 2 to 3 of the face of the head. We'll just slowly move it around. Check in with the patient. Are you still doing okay? Mm-hmm. All right. And as I'm moving, I'm not seeing any reaction on the skin to the ultrasound or the gel. No change in color or appearance. All right. So we're gonna go ahead and finish up the treatment and turn off the machine while everything's still in contact with one another. Now that the machine's off, it's safe to remove the head. And are you all right if I wipe off the gel?
Mm-hmm. Go for it.
All right, and the skin still looks good, and you still doing okay?
Mm-hmm.
All
yep,
right.
Good.